clarified that. All right, welcome in. Hey, we are talking about many humans suffer with dry eye, but our pets can too. And Dr. Jerome Williams, our regular guest here on Good Day Alabama, bringing in a specialist today, Dr. Susan Nelms, to talk about that. And you brought with you.
And this is Angel.
Hello, Angel. All right, so I've never dealt with that, but I know people who do. It's really difficult.
Yeah, it can be really uncomfortable.
So what's going on with our dog when that happens?
So when dogs have dry eye, it can be much more severe than for people.
Really?
And one of the first signs of a dog with dry eye is going to be mucousy discharge from the eye.
Okay.
So the watery part of the tear film dries up and the eye continues to produce kind of a thick mucousy discharge, and that's one of the very first signs.
You actually see it?
You actually see it, and we'll look at some pictures of that in just a few minutes. There are a lot of breeds that are predisposed to dry eye, and the Shih Tzu is one common breed, and so that it typically manifests with irritation.
What happens untreated?
Untreated, it can be blinding.
Oh,
so
gosh.
it can become that severe that the cornea becomes inflamed and pigmented, and vision becomes impaired.
The friction from the dryness can actually cause the eye to ulcerate and rupture.
That's correct.
All right, let's look at Bailey. I think we have Bailey. We do. That's what I was told.
That's Bailey.
Okay.
And Bailey is a 15-year-old Shih Tzu. And for a few months, his dad noticed that there was this mucousy, goopy discharge coming from his eyes.
Oh, poor baby.
And in the left eye, it's actually the vision had become impaired. So,
oh man.
But this is treatable, and that's the great news is that it's treatable with eye drops.
Sometimes we notice those that have gone for a long time. The eyes are pigmented. There's a black pigment that has covered the surface of the eye.
So now, do you pick up on it sometimes when you're just doing a checkup?
Yes.
Yes, it's something that's often picked up by the family veterinarian.
Okay.
And
I think Joey's next.
Yes.
Let's see Joey.
Joey had a much more severe case, and actually you would think that his eye would be much drier than Bailey's, but in the early stages, it's not always as obvious, and one of the very first signs could be a corneal ulcer. And Joey developed a corneal ulcer that became infected and became a very severe risk for rupturing. So that's why we saw Joey. And he's on he's on very aggressive medical management, and should be seeing him back this week.
Fortunately, we have medications now that can manage this.
Right.
And one of the drugs that you mentioned to me earlier about Restasis is the same drug that we use, a similar drug that we use on animals for the dry eyes.
Now, if you notice this in a dog, do you automatically send to a specialist, or can you treat?
I can treat most of those when they're not responsive.
So you can use the drops.
Yes,
use the
that's
drops.
right. That's right.
So how often do you put drops in them? Is it daily?
Usually twice a day.
Twice a day?
Some dogs and actually the key to dry eye is early diagnosis. The earlier they're diagnosed, they tend to respond much better to treatment.
I think we have one more picture. We got a few seconds left.
And the medication causes the tear glands to start to secrete again.
That's Pickles.
Pickles
and
a pug?
Pickles is
What's
a pug.
Pickles? Okay.
And pugs have a combination of not just the dry eye, but you can see the really buggy exposed eyes, as a lot of the Shih Tzus do. So Pickles also has corneal ulcers.
Now you showed these are three, smaller breed dogs. Does it happen in bigger?
It does
larger
happen
breeds?
in larger breeds, but much more common in those smaller breeds that have a genetic predisposition.
You're tired. You're tired. This one's yawning. I hear you. Feel you. All right. So if you notice something, or just if you have a regular checkup, is that something you would normally check for?
Yes.
Okay. All right. So you looked at Buddy last time I was there?
Yes, we looked at Buddy. If your eyes are red, the mucousy that Dr. Nelms talked about, that gunky stuff, that's an indication that something is not right. So you need to see a veterinarian.
Okay. All right. Well, great advice.
Dr. Nelms is on exit 6.
Exit 6 off 459 at the Hoover Bessemer exit. Helena Bessemer.
An outstanding ophthalmologist.
All right. Very good.
Thank you.
Thank you.
Thanks for having me.
Good to see you.
Good to see you.